morning, my name is Ashley Triplett. I am part of English 112 Section 620, and I'm going to talk to you about medical marijuana. I chose this topic because this is something that I do not know a whole lot about, and this is something that I could learn for myself. Really, the only thing that I know about marijuana is that it's illegal as a drug, and that people use it to get high and they smoke it, and makes them high, makes them unaware of what's going on, and it's very dangerous to those around them, especially if they're driving or doing activities. As a mother, I have seen some articles where parents are trying to advocate this for their children, and it breaks my heart that this is not available for children that need it. As I have read through this and researched, there are so many positives that I have found about this plant, not just the plant, but the chemicals that it contains. Marijuana itself is a green grayish plant. It's dried leaves from cannabis flowers, and this picture here is an actual plant before it's been dried. It's green and pretty. Really looks like something you might find in a garden somewhere. Some other names that you would hear, slang names, or Mary Jane, pot, hemp, herb, or grass. There are two big chemicals here that we are looking for in this plant. It is THC and CBD. These chemicals are used in pill form or oil form in treating certain conditions or chronic pain management. The purpose of this plant can help someone who has epilepsy, a seizure disorder that's very debilitating. This can be found in an oil form that can be taken to help someone to reduce the amount of seizures they have in a day, or someone who has HIV, who has that extreme nausea and has a hard time, maintaining a healthy weight due to the dangers and the setbacks from this disease. Chronic skin conditions or glaucoma. Glaucoma affects your vision because of the pressure in the eye over time. Cancer patients who are going through chemotherapy. This is very close to my heart as my grandfather just went through chemotherapy. Chemotherapy is very, painful. It makes you sick, makes you hurt, makes you nauseous, makes you throw up. Very hard to maintain a healthy weight, to maintain a healthy diet, to be healthy in general, to try to fight the cancer and to be there for your family and loved ones. I would push this, to help those who are taking chemotherapy, children, adults, whomever. This is very, very wonderful that can help them. Let's see, the main ingredients again are THC and CBD. These chemicals come from the plant themselves. It's not the actual plant that they're wanting, it's the chemicals within the plant. The cool thing that I have found is the body actually makes its own form of CBD, and that helps to control your blood pressure, your memory, help you to think clearly. It controls your senses. It helps you with your appetite and to be aware of time and your surroundings and what's going on around you. Also, it can help with reducing pain and inflammation and controlling seizures again as well. So this is a very, very amazing chemical found in this plant that can be grown basically anywhere because people do it all the time illegally. So why not make this legal and make it available to those who really need it? Side effects can be lung damage, weakening of the immune system because of the impurities in the plant, and physical and cognitive impairments. But we're not smoking this, so there's nothing to worry about as far as your lungs and the impurities. We're only pulling out what we need from the plants, which are those two main chemicals. So there's really no big side effects so far that we have found that could hurt or harm your body. The positives, revenue. This could bring in lots of revenue, creating greenhouses to grow this, creating jobs. The government can tax it, so there's more money to bring in that way because there are so many people who have cancer, so many people who have seizure disorders, so many people who have chronic pain disorders that could benefit from this medication. In this video here, you're going to see the struggle that a mother is going through every day with her child, and this is something that we can minimize and get rid of if we just make this legal and make it available for those who need it.
An Arizona couple is fighting to get their 5-year-old son the marijuana treatment they say he desperately needs. Xander Weldon has autism and a brain disorder which causes weekly seizures. He can't speak or use his hands. After Xander's parents heard about cannabis oil helping other disabled children, they figured they would test it out. But in Arizona, cannabis oil is not approved as a form of medical marijuana. The Weldons say they are now being forced to give Xander a less pleasant treatment.
The way that we're having to do it now is to take this marijuana plant and crush it up and mix it into like a pudding or an applesauce, and then trying to get him to eat it.
And now the Weldons are suing the state of Arizona with the help of the American Civil Liberties Union, and they fear they may get arrested for giving Xander an illegal substance.
So there you go. That just opened your eyes to the struggle that parents are having. So let's create the jobs. Let's create the money. Let's make this readily available in every state so anyone that needs it can stay at home and get it and not have to worry about, having the fear of going to jail because they're trying to do the best for their child, but yet it may not be legal in their state and they may not have the ability to move. So let's put the fight there. Let's advocate for this. Let's make it known that we need to move forward with this process and make this legal for anyone who may need it and may have a medical reason for it. Thank you so much.